I'm Dr. Valerie Masuda. I'm a palliative care physician, and welcome to Tea with Val. Today, we're going to talk about planning. Planning for care and financial planning for people with life-limiting illness. Just like you don't plan to buy snow tires after the first blizzard, we're going to talk a little bit about how to anticipate what your needs are going to be and how to plan for those needs.
We're going to start by looking at energy levels, because energy levels are going to dictate when you start to look at different resources that you will need in the future and when to actually activate those resources. If you have people with life-limiting illness with energy levels of 70, 80, 90, 100%, maybe having life-prolonging interventions such as chemotherapy or dialysis or other interventions, their energy may stay in this level for months or years, but it doesn't matter. You still need to plan because nobody can really anticipate their trajectory. If you're very fit, this is a time where you may be able or not to work full time. You will be managing well at home. So now is the time to plan. And it's time to look at things like disability insurance, terminal illness CPP, where you can apply for CPP earlier than age 60 because you've been diagnosed with a terminal illness. Looking at unemployment insurance, do you qualify? Do you have extended health benefits? Do you have critical illness insurance? This is a time where you should be writing a will if you don't already have one. A lot of people think, if I write a will, I'm going to die. But I've had an active will since my children were born, and I review it every 5 years because you never know. You could be on a trip, you could be walking across the street, and something terrible happens to you. If you're young, you want to make sure that your children are going to be cared for, so child guardianship may be an issue. You should have somebody who's named as your power of attorney, and is particularly an enduring power of attorney. And this allows somebody to pay your bills for you and make financial decisions on your behalf if you're unable to do that. You need a health representation who is going to speak on your behalf for your medical care if you are unable to speak on your own behalf. So health representation is not the same as a power of attorney, and you need both. And the person who is your health representative may be very different than the person who's your POA. We talked about goals of care in a previous video, so if you haven't reviewed advanced care planning, then I suggest that would be a good video to watch. And you have to look also at this time about, are you going to move assets? This is a time where if you're married and your property is only one name, it may be worthwhile changing the title to include both of you. Cars, recreational vehicles, boats, and property should be held in joint ownership. So taking stock of your resources, life insurance. So if you have a diagnosis of life-limiting illness, sometimes policies will forward 50% of benefits for end-of-life care. Veterans will qualify for money to support housekeeping, garden, and house maintenance, as well as personal care for up to $25,000. Extended health benefits for people, particularly government workers or military, can include up to $30,000 of money for nursing care. Pharmacare coverage has a deductible based on your last year's tax return in British Columbia. If you can't work because of illness, it may be impossible to afford your deductible, particularly if you're having chemotherapy or other interventions. So call Pharmacare and let them know you're not working, and they will recalculate your deductible. Another thing is that if you have an RSP and you have money in that, you can use it. Mortgage line of credit. If you own your home and you can use this asset to finance a line of credit with the bank, you don't have to pay a fee if you don't use it and it just stays empty. But if you do use it for care needs, then you only have to pay the interest on the account monthly. Then you can use this, for example, to help pay for a family member to care for you, or you can use it for private nursing care. And after you die, your estate would pay off the line of credit debt. Mortgage insurance, deferring credit card payments, if, for example, you have to take time off work and you're finding it very difficult to pay for these expenses. And also to take stock of family and friends who can take care of you when you need care. If your energy is quite good, then now's the time to actually look at your bucket list. And you may want to travel and see the sites you haven't seen. You go to that graduation, take you that hot air balloon ride, and visit the grandkids. Because when you're fit, this is the time to do all that stuff. If you always wait until you're feeling better, you may never feel better and you'll miss those opportunities. So let's talk about when energy is reduced to about 60% of normal. These are people who they're independent, but they just don't have the same amount of energy. They're still able to function independently. They are unable to work full-time or even part-time. So this is the time to plan for help. Who, when you can't do this, is going to take care of your garden, rake the leaves, chop the wood? Who's going to be doing the home maintenance? Who's going to be shopping or cooking or doing the housekeeping, laundry? Who's going to be looking at helping you with appointments, helping you get there? And who's going to be helping you with banking? And then planning for healthcare. So now's the time to look at what kind of home supports are available. And again, reliving what are your goals of care at this time. So then we start looking at, as your energy progresses down to 50% of normal. There are people that are still independent in their self-care. They're not doing things like gardening, shopping. They may not be cooking their own meals. So now you need to plan for what happens now when you need a lot of personal care, like help in the shower, help getting out of bed, and equipment to support you in your lower bits of energy. This can include an electric bed, it can include a commode and other kinds of resources, as well as home care nursing, setting up a lifeline to a neighbor or family member in case you fall. And then ultimately, who is going to care for you? If a family member wants to care for you, they can apply for a compassionate EI. And this is provides unemployment insurance benefits, about 55% of somebody's normal income, up to a certain maximum, for up to 26 weeks, and can be shared amongst family members. So the total comes to 26 weeks. Some people find that it's really difficult to live on compassionate EI because, again, it's only 55% of your normal income or less. So this is where, if previously you had planned for this inevitability, you may have saved some financial resources or planned financial resources to be able to subsidize a family member to help care for you. Public resources usually mean home care resources. And most communities in British Columbia have a home and community care service. If you have the financial resources, you can hire a nurse or a licensed practical nurse or somebody like a community support worker to help with your care. But this is something that you would pay for yourself. Some other people actually hire their own nurse rather than use a private nursing company. And this way they know exactly who they're hiring and what kind of duties they would expect that person to perform in the home. And this may include things like light housekeeping or laundry, as well as personal care. And then when your energy is really low, where are you going to spend that time? Are you going to have the resources to stay at home? Are you going to have the resources to stay at home all the way to die at home, where most people want to spend their last few days? Or do you need to move to a hospice for end-of-life care. Some communities may not have a hospice, and so that would mean going to the hospital for end-of-life care. There are lots of resources out there to help you plan around your care. You can look at the Family Caregivers of BC, and there's some really useful apps such as Caring Bridge and Caring Village, where you can have an app where you would have friends and family that are involved in this app. And if you had an appointment, you would say, hey, I have an appointment Monday, December the 17th. Hey, who's out there who can give me a ride? And everybody gets that message, and people can respond and say, hey, I'll give you that ride. It can be really helpful for care providers or caregivers if they're looking for somebody to even do some respite, is saying, hey, I need some respite every Friday afternoon. And you may have 3 friends that come up to the plate and say, hey, I'll take one of those Friday afternoons. So using these kinds of resources is really important. The public healthcare system may offer a community support worker a few times a day to help with personal care, but it is nothing like having a family member. And family members and friends will provide up to 90% of the kind of care that's needed for people who are bedbound or have high care needs. To access these kinds of public health care systems, you can see your family doctor and ask for a referral, or you can call your local health authority, and you may also be able to refer directly yourself or a family member for home care support. So what if you have frailty down to 40% of normal? This is a time where you really need to look at your goals of care. Are you going to return to hospital, for example, if you're sick, and have life-prolonging interventions such as intravenous antibiotics, such as transfusions? Or are you going to look at trying to really focus your care on comfort care and not looking at rescuing you to delay your dying time? So this is an important conversation to have with your health representative as well as your care providers like your family doctor. If you're planning on staying at home for home death, you need an expected death in the home form. And this means that when you die, your caregivers just need to call a funeral home. They do not have to have a coroner involved. They do not have to call the police in or ambulance. So all that happens is when somebody stops breathing, the family waits for an hour, they call the funeral home, and then give them the EDIS form. At the same time, we need a do not resuscitate form in the home as well, so that nobody attempts CPR if you've died. And then we want to make sure that the focus is on comfort. And this can be done through proactively a physician providing medications in your home so that home care nursing can access those medications if, for example, you can no longer swallow pain medications. We have quite robust palliative care systems in the community, which allow people to die in their home. And then this is a time for also planning those things like celebrations, ceremonies, important rituals, and family gatherings. And this may be a time where you want to make some funeral arrangements. And it's always helpful for the family if you write some things down about your own life, or even write your own obituary. And at the very end of life, this time is a sacred time. This is a time where family and friends come together to support you. It's a time of connection and reconciliation. It's a time of introspection and self-reflection, a life review, and considering what has been the meaning of your life. And for me, I witnessed phenomenal spiritual and personal growth during this time for many people. So this is a time of planning. This is a time of planning for inevitability. And that inevitability may be over years and maybe over months. And unfortunately for some, maybe over weeks. So it's important to make these plans ahead of time. So if you're able to plan ahead, get your resources in line, then there's never a crisis. What I see too often are families in crisis because none of this planning has happened. Certainly from a financial aspect. I've seen families that have qualified for $30,000 worth of money in personal care, only never to access it because their loved one has died before they've even completed the paperwork. So it's important to get your ducks in a row early when you have the energy and have these plans available so that your health representative, your family and friends know what's up and can support you for this most important time of your life.
Here are some resources that you may find useful. Both these books were designed and written by palliative care physicians in Canada, which help you plan both for your care and finances. I would highly recommend ordering them and reading them. I've also provided a link in the comments below on how you can access what we've talked about in written form, and it may be more helpful. Thank you for joining me on Tea with Val. If you found this video helpful, please feel free to share. As well, you can like this video and you can also subscribe to this channel for more videos.